Dr. Soto, you've had the CoolSculpting device longer than anyone in Central Florida. Can you tell us a little bit more about the success we've had and what we've learned from this device?
Oh yeah, absolutely. Let's see, I guess we got our CoolSculpting by Zeltiq device in May or June of last year. So we've had it about a year now. In fact, we did get it a few months before the FDA actually approved it. It was a very exciting time, I remember. And even when we acquired the device, I was a bit skeptical about what exactly it was going to achieve and how satisfied our patients might be with it. But I can tell you very, very happily that after a year of time has passed and many, many patients have been treated, I'm actually really, really happy and pleasantly surprised by how well it works, how easy the treatments are, and how happy our patients are. Now, I think that the benefits of the CoolSculpting device are obvious to most people, but just to kind of generally recap the idea here, the CoolSculpting device applies a principle called cryolipolysis, which is a fancy way of just saying that if you make fat cells cold, you can cause them to basically commit suicide. They die. And the temperature that's required to cause the death of fat cells is a temperature that is not dangerous to skin or blood vessels or nerves or muscle tissue. And so that's really cool because you can kill fat cells without harming anything else just by making the fat cells cold to a certain temperature. Now, the obvious advantages are that you're removing fat cells and they're being removed permanently because the fat cells are actually dying. So they're going away forever. They won't ever come back. Your body won't make more. You don't need surgery to do this. You don't need anesthesia to do this. The treatment is not painful. There's no recovery time in terms of restrictions after the procedure. You don't need to wear any special garments. You don't need to stop doing things or start doing things that you didn't do before the treatment in order to get the best outcome. You can immediately leave my office after the treatment and go to the gym or go out to dinner or go do whatever you would have done. So those are all obvious advantages. And those are the things that patients tend to have in their mind when they come to see us about it. There are a few things to know in terms of, having a realistic expectation. With CoolSculpting by Zeltiq, you're not going to be able to remove or kill as many fat cells as you would if you had a liposuction procedure. That's simply just not going to happen. With a well-done liposuction procedure by a board-certified plastic surgeon, you can expect a pretty dramatic result in most cases with a high degree of safety. CoolSculpting is not going to give you a dramatic improvement with one treatment. Now, sometimes with 2 treatments or even 3 treatments, you can achieve a pretty dramatic result. But that occurs over a period of months and would require 2 or 3 treatments. So you're not going to get as much improvement as you would with surgery. It is going to take time because the treatment itself kills the fat cells, but then it takes your body about 8 weeks to eliminate the dead fat cells. So you do need to be patient waiting for the improvement in appearance to occur. But on the other hand, you are avoiding surgery, you are avoiding anesthesia. It is permanent and it definitely works with an extremely high rate of safety. So I think CoolSculpting is here to stay and it's a fantastic option we're happy to offer our patients.
And what areas of the body would you say that patients have had the most success with so far?
Well, when the CoolSculpting device first came out, it had an indication for treatment of the love handle area and the lower abdomen. But as time went by and we got more comfortable with the device and the handpieces, we've treated lots of areas of the body very successfully. We've treated the back of the arms. A lot of women have a little bit of extra tissue on the back of their arms that makes them crazy. They hate it, but it's not enough for them to want to have surgery. And so CoolSculpting is great. They come sit in the office for a couple of hours and a few weeks later the back of their arm is smaller. We've done the bra fat area, again, another area that most women hate. And quite often by the time a woman is 35 or 40, if she's had a child or 2, they have a little bit of extra skin and fatty tissue in the bra line area on the back. And those, again, it's an area that drives women crazy. They don't like it, but it's not enough to make them want to have surgery. CoolSculpting is great for that area too. Very effective, and people are very happy with the improvement. Obviously, we've done lots of love handles and lots of abdominal pooches because those are the indications that initially were reported for the CoolSculpting device. But we've also done inner thighs. We've done banana rolls, that little area of fat just below the butt that, again, a lot of women don't like to see in their bathing suits. So we've treated a lot of these areas very successfully. The key is having a good exam, because we need to know whether or not you as an individual are going to be a good candidate. But these are all areas that in good candidates we've had great success with.
All right, well, thank you, Dr. Soto, for your time, and we will see you next time.
My pleasure.